all to hear. Alrighty. So at this time, I'm going to pass it over to Professor Bass Wright, who is going to tell us about her experience in living with rheumatoid arthritis.
Well, good morning, ladies. Talk about living with it. Today is not one of my best days, so I had to dress simple, easy, and I don't know. I just want to share with you just my path. A few years ago, I went to my OBGYN and I was complaining of some symptoms, and she had a colleague that she'd gone to medical school with, who was a rheumatologist, and she referred me to him. And we talked a little bit. He ran some tests and told me my RH factor was high, and that was about it. It's like, okay. But at the time, I really wanted to talk to him. I had been a vegetarian for many, many years. I'm really very health conscious, and I was just trying to help him understand. I said, I think there's a connection between sugar and pain. I think there's something going on with with the food or something. And he didn't really acknowledge what I was saying much, and so I went on my way. So years later, much more recently, I started having problems with my hands, and I thought that it was carpal tunnel. I literally would lose use of my hands, and I was concerned because, as you all well know, I'm a professor. I teach classes. I type a lot. I use we use our hands for everything. And so I kind of reached out to my, I'm so sorry. I reached out to my administrators. I sent them a writing sample. I said, I don't know if how I'm going to move forward with my courses. I was just worried, because again, you can't use your hands, you can't write, and I got the feeling that, well, I didn't get an acknowledgement. They did not text me back. They did not reach out to me. I said, okay, I'm gonna have to deal with this. It just got progressively worse. And again, when you can't use your hands, you can't do anything, and so I thought, well, I'll just start Googling, and I did end up going to my PA. At that time, my legs were bothering me. I would just had difficulty walking. I was in excruciating pain. I was in so much pain, the lab tech taking my blood was flinching for me. After my meeting with her, at the end of that meeting, she kind of literally looked over her shoulder and she said, taking a lead. She says, no, by the way, take two. I was like, okay, okay. Again, not full acknowledgement of what was going on. So over the course of time, we moved into COVID. At that time, you remember, I don't know if anybody remembers how serious it was. Doctors were not seeing patients. They weren't taking new patients. I reached out to every rheumatologist that I could find or think of. Again, not taking patients, maternity. It was just, and so I did what we do best. I started researching, and again, I thought it was my hands. And so I found myself an orthopedic surgeon. I was ready to go. I'm like, we need to fix these hands. I went back to my PA, who that particular day was listening. She says, no, that's a little extreme. I think it's inflammatory. I was like, okay. She did, fortunately, they found me and hooked me up with a rheumatologist through the UT health system. And I started going to him. He did all the labs, he did the work, all that x-raying, and finally fell upon a diagnosis. I am prayerfully, and I feel so blessed to have not had serious compromise. They did find a little bit in the spinal region. And so he started me on medications. The thing is that doctors are so good at what they do. And I think when they are specialists, they understand, but the patients don't. And I did not understand what I was dealing with. And so I was like, I'm thinking, well, I can figure out a cure through eating. I'm like, well, because I'd heard of this word called remission. And I'm talking to him about food. And he, being the scientist that he is, he just listened to me and was like, basically, yes, there is some evidence that, through a change of diet. However, he started me on a course of methotrexate and hydroxychloroquine. I don't know if you all know meds, but methotrexate is pretty powerful stuff. Again, I was at a lower dosage. I'm at the highest dosage I can go with, in terms of not messing it really being, my body being able to absorb it. Methotrexate and hydroxychloroquine are pretty serious. I ended up having to, with the hydroxychloroquine, I will probably, as long as I take it, have to see an ophthalmologist because of the impact that it could potentially have on my retina. Um, and the methotrexate, I take it, but because it at high dosage is a drug that treats cancer, you do have some of the with symptoms, of taking the medication. So I take it on Thursday, on Friday, I'm just out of it. And I can't do much. I'm just, it causes almost like a depression. It's settled. It's just very strange. And so, but we do what we have to do because you're listening to the doctors. And I have found that by trying to manage my diet and eating a bit more clean or cleaner, as they say, that it has gotten better. But it comes back. And I heard the rain this morning and I was like, oh gosh. And sure enough, it's back. Day I could not move. It was in my upper spinal region. And it had gotten to the point where at its worst, I had to change my wardrobe because I simply could not dress myself. Um, you know, I was afraid of driving because you lose mobility, and it's just something that I think that because it is so silent that people don't realize. And when you're dealing with chronic pain, if you're bleeding through your eyeballs, I think people understand that. When it is not something that people fully understand, they don't understand, and so I had to learn how to advocate for myself and to take care of myself. But it is not something that I like to talk about a lot because I don't want to feel, people to feel pity. I don't want my family to worry. But, there are days when you just can't function, you just don't function. Fortunately, I have found over the web, a few discussion boards. The Rheumatoid Arthritis Foundation has a wonderful site, and they teach you hacks about how to live. I found it kind of funny. I had my newest prescription for methotrexate, and the prescription bottles. I'm like, of all the people, we can barely dress ourselves. I mean, I'm trying to open this medication, and it's just so very humbling. But I am grateful that I have a diagnosis. I'm learning how to live with it, and I just had to humble myself and just share with the people in my life. Some days I just can't come to work. I just, and it's kind of like, when you have morning sickness, you can't get documentation for it. There's no documentation for it, but I have to say, look, I can't drive, and so, you just move on and you learn, how to live with it. But I'm glad that we're talking about it because it is one of those things that, again, it's difficult kind of finding the diagnosis and finding individuals that are compassionate and that will meet you right where you are. Because I'm just going to tell you, ladies, and I was an addiction specialist. I treated people, but I understand how people can become addicted to medication because you just want relief. You just want to be able to function normally. And, it's kind of tough, and I will say that, but I did share. One semester I had to because I was going to be in and out of class for appointments. And one of my students simply texted me back, yes, my little sister was diagnosed at 14. And people just started sharing their stories. And I thought, wow, I'm not in this alone. Because when you go to the doctor's office, it's just you and your doctor. There is no community. And so the extent to which we can begin to develop that, and then I can share and help in that area, I'd be more than happy to. Thank you, guys.
Thank you so much, Professor Bass Wright. Thank you for sharing. I learned a lot from people like yourself who have shared. Even as a nurse, you don't really hear too much about it, but I have come across women that I took care of that explained to me what, in similar terms, what you were saying, that it was hard for them to get the treatment that they felt like they needed, or even to be diagnosed because it was almost dismissed. Similar to fibromyalgia, same kind of thing I've been hearing. And also, I'll say this, and I want to introduce our speaker and hand the floor over to her. I remember while teaching, being a TA, a teaching assistant with nursing students, one of my nursing students had talked to me on the side and cried in tears, and she said, I never show it in clinical because I want no one to have pity on me. She said, but some days it's just so painful. It's hard for me to do what's so easy to everyone else. So thank you so much for sharing your story and being so open to share it with all of us. So at this time, it gives me great pleasure to introduce beautiful Dr. Nilanjana Bose. Dr. Bose has had a distinguished academic and clinical career. She completed her internship at William Beaumont Hospital in Royal Oak, Michigan, residency in internal medicine at the University of Oklahoma in Tulsa, and rheumatology fellowship at the Cleveland Clinic in Cleveland, Ohio. She is board certified in rheumatology and enjoys the challenges of taking care of patients with diverse rheumatologic problems. She also completed an online MBA program with a focus on healthcare administration through the University of Massachusetts Amherst in 2019, adding to her skills. She has worked in diverse clinical settings from 2011 through 2022, from the VA hospital in Richmond, Virginia, to a university-based clinic at UTMB Galveston, and then at a private rheumatology practice in Pearland. Providing the very best in rheumatologic care in pursuit of her passion to provide a personalized approach to rheumatology patients, she started Lonestar Rheumatology in 2022. Dr. Bose has authored several articles in peer-reviewed journals. She has also contributed to rheumatology book chapters and presented her research at multiple meetings. She regularly contributes to online articles on arthritis-related topics for public awareness and is actively involved with the Arthritis Foundation in Houston. She enjoys being an active member of the community. She is a member of the Memorial Hermann MHMD Physician Network and also affiliated with HCA Houston Healthcare Pearland. She has been a Castle Conley Top Doctor since 2021. Dr. Bose is an active member of the American College of Rheumatology. Her hobbies include Indian classical dance and traveling. So at this time, we pass the floor to you, Dr. Bose.
Thank you so much for the kind introduction. Are you able to hear me okay? So yeah, my name is Nilanjana Bose, and I'm so honored to be here with all of you. It sounds, like every one of you has a story to tell, and I am blessed to be a rheumatologist. I think I'm in a field that I'm able to hopefully help, if not help, at least listen to my patients and try to give them the help they need. We don't always have a diagnosis for everyone who comes to us, but in rheumatology, and rheumatology is a field that has many shades of gray. My patients laugh when I tell them that, but it's true. So, but we're also fortunate that our field has made tremendous progress, and we've had a lot of good treatments come our way. So rheumatoid arthritis being one of the main diseases we treat. And of course, as Ms. Shirley, her story is so moving because it resonates with me. I really wish and hope everyone gets the care they need because we have such good treatments now that we're able to get our rheumatoid patients a lot of relief early on. But she makes a very good point about lifestyle and just general awareness because I find patients who are able to combine that along with having a compassionate doctor, they achieve the best results in life. So again, I'm honored to be here. I'm happy to answer questions, and I don't have a presentation. We're just going to do some short videos from my YouTube channel, which is basically for my patients and anyone who wants to learn. Hopefully they won't be too boring.
So, rheumatoid arthritis is a kind of inflammation that can affect your joints and cause pain, swelling, deformities. It can affect organs as well. So, if you are having pain and swelling in your joints, please see your rheumatologist for a complete evaluation. We typically will do labs and imaging, and there are a variety of medications that can help you combat and treat rheumatoid arthritis. This is Dr. Nilanjana Bose from Lonestar Rheumatology. Thank you. Polymyalgia rheumatica or
Dr. Bose, did you want me to stop? Okay. Oh, you're muted. That's okay.
We'll do the next one. Can I have our OA with RA?
Yes, ma'am.
Thank you.
Oh, sorry about that. Give me one. Let me pull it up on my other screen.
Or PMR is a fairly common condition.
Okay, and you said it was the, can I have, oh, wait,
Yes.
all right. Very good.
Yes.
Yeah. Okay, let me go ahead and share that one. I'm a fan of her videos, y'all. I'm sorry. So you'll hear me say that about every single video. Okay, here we go. It's right here. Okay, sorry about that. Someone else was coming in, so I had to admit them. Okay, here we go.
Hello. I am often asked by patients, what kind of arthritis do I have? So, can you have rheumatoid arthritis and osteoarthritis together? The answer is a little more complicated. It really depends on what kind of arthritis you've been diagnosed with. For example, if you have rheumatoid arthritis and you've had it for some time, you could also develop osteoarthritis. As you may know, osteoarthritis is a degenerative process and occurs to most of us as part of the aging process. However, osteoarthritis can also occur in damaged joints. So if you have had rheumatoid arthritis, which has caused joint damage, secondary osteoarthritis can set in. So in short, the answer is yes, you can have rheumatoid arthritis and osteoarthritis together. Similarly, you could have psoriatic arthritis and osteoarthritis together, or lupus and osteoarthritis together. The treatment really depends on which arthritis is causing the issues. If your rheumatoid or psoriatic arthritis
Uh-oh, sorry, it's buffering.
is active, then we of course suppress the immune system so that we can treat the arthritis. However, if your rheumatoid or psoriatic arthritis is inactive or in remission, then and we think that it's mainly osteoarthritis causing the pain, then the treatment is a little different, and we discuss pain management, physical therapy, arthritis supplements, topical creams, etc. So overall, this is not an easy answer. So I hope this helps. This is Dr. Nilanjana Bose from Lonestar Rheumatology. Thank you.
Next video? Okay. And it's lifestyle changes, Dr. Bose, is that correct? Okay.
Hello. Lifestyle changes are very important in the management of all chronic conditions, including rheumatologic diseases. I normally counsel my patients on 5 aspects of lifestyle changes. Number 1, diet. Try to avoid carbs, sugars, beef, and pork, and that should help reduce inflammation. Number 2, the right kind of exercise. Low impact aerobic exercise can be very helpful for maintaining a healthy weight and your general health. Number 3, stress management techniques like meditation, yoga, deep breathing can be very beneficial overall. Number 4, mood. If you have any mood disorders or suspect you may have some, please consult with your psychologist or psychiatrist for an evaluation and treatment. Number 5, and certainly not the least important, is sleep. Getting good, refreshing sleep is very important to good health. This is Dr. Nilanjana Bose. Thank you.
Okay, and let me pull up the other video, the next one.
Usually with rheumatoid arthritis, DMARDs are the first line of therapy for a lot of patients. DMARDs are disease-modifying anti-rheumatic drugs that are usually oral, and they basically work by modulating the immune system. So they ultimately reduce inflammation and are very beneficial in treatment of rheumatoid arthritis. These are slow-acting drugs, so the action is not instantaneous. They usually start working within a few weeks. So if you've started them on a DMARD and given it a few weeks, 1 to 2 months at least, and the disease is still active, or they don't feel good, then maybe the drug isn't working. But what we need to understand is the patient taking the drug the right way? So if we've decided that the medication is not working and not a problem with compliance, then the next step would be to change the DMARD or add another DMARD. The other thing is if the patient has very aggressive rheumatoid arthritis and is otherwise young and healthy, then the other option is to just maybe add on a biologic. So both approaches are valid. It just depends on the patient and their situation. Biologics are usually injectable drugs, so they can be injected by the patient or they can be infused in a clinic. And we have the newer small molecules, which are actually oral. These are very strong drugs that ultimately suppress inflammation. So we have drugs that are given every 2 months as an infusion, or the patient can take self-inject every week, every 2 weeks, every 4 weeks. The oral pills are usually daily. Patients ask us all the time whether or not a biologic treatment is lifetime or not really depends on the patient's initial presentation, their ongoing symptoms, their other comorbidities. So a lot of times biologics may be needed for a long time, even if the patient goes into remission. Regarding pausing the biologic, one reason could be just intolerance or side effects to the medication. Improper technique of administration where the patient is just not being able to give the medication themselves if it's a self-injectable. Maybe they have an infection and they know that they need to pause their biologic. And fourthly, they might have to stop or pause the biologic if they're just not getting the benefit they are expecting. Once a patient has paused their biologic, number one, they should let the doctor know. So if we don't know, we really can't help. Once the patient informs us, we typically would like them to come in for a visit or do a televisit with us so that we can discuss the reasons why they are not being able to take their drug. Depending on why they had to pause or stop the drug, we can find alternatives.
It was a pop star studded graduation for New York University's class.
Sorry about that, Dr. Bose. Go right ahead.
No, thank you so much for arranging for the videos. So, again, those videos were really meant as a brief educational insight into RA and the many facets of RA, including medications, lifestyle, etc. So I'm happy to answer any questions. I don't want to bore anyone, so didn't want to make it a slides. So I suppose, we'll just take questions.
Can you tell, can I ask a question?
Go ahead.
Can you tell us the difference between rheumatoid and osteoarthritis?
Sure. Great question. So both are arthritis. So basically, arthritis is any condition that causes joint pain, joint swelling. So there are many kinds of arthritis, including osteoarthritis, rheumatoid arthritis, lupus, etc., gout. So the main difference is what is the mechanism. So osteoarthritis is degenerative arthritis or wear and tear arthritis. This is the most common kind of arthritis that happens with all human beings as we use our joints. And it is not associated with an immune dysfunction. So the treatment does not involve suppressing the immune system. Whereas on the other hand, inflammatory arthritis, which involves the immune system and inflammation, that includes diseases like rheumatoid arthritis, psoriatic arthritis, etc., where there is pain and inflammation in the joints, but the disease process involves much more than the joints. There's also the organs that can be involved from the widespread inflammation.
Wow. Wow. So it's no real cure for it. It just continued to get worse, or it's stabilized with medicines, the rheumatoid.
Rheumatoid? No, so rheumatoid arthritis is very treatable if caught and diagnosed at the right time. We don't, it's not curable per se. There are patients who can go into remission and do so. I wouldn't like to say it's curable. That is, we take it out and it's just like taking out a tumor, but it is a chronic condition. We have to think of it as a chronic lifelong condition, but it may or may not need lifelong treatment. It really depends on the patient.
Thank you.
No
Appreciate
problem.
it.
No problem.
I have a question. The process of diagnosing rheumatoid versus osteoarthritis, how is it distinguished?
So it really needs a visit to the rheumatologist. So it's a combination of a very good detailed history, physical examination, assessment of your blood work, your imaging results, and then coming up with a diagnosis. I will say that sometimes the differentiation is not as clear. And as you saw in the video, some patients can have more than one kind of arthritis. However, our treatment goals change depending on which one is the main driver of pain and the issues with the patient. And we do have lab testing and imaging results that help us as rheumatologists direct our treatment towards which is the predominant type of arthritis.
So there are markers in the blood work that would indicate that it was rheumatoid arthritis?
So there are the markers, there's the rheumatoid factor and the CCP. However, up to a third of rheumatoid arthritis patients do not have these markers. So just relying on markers alone are not enough. So that's why, rheumatologists are a special breed, because we can't just rely on markers and imaging results. There are some patients who don't have markers, don't have any imaging, any deformities on imaging, but yet have rheumatoid arthritis. So it can be a subtle diagnosis. So that's why a good trained rheumatologist can really help.
Thank you very much.
No problem.
Professor, you had your hand up?
I just want to say, if anyone has any questions, me, having, living the life and dealing with it, certainly feel free to ask. And that was one of the things that was, I wanted to know the process, the diagnostic process as well. And so the blood work and the continual blood work and then the imaging really, I think, obviously helped the doctor to land upon it. What's so interesting though is, and as a patient trying to learn how to manage and how to live with it, the lifestyle changes are very, very real. I'm very, very careful. There's certain things I do not do anymore, or things that I certainly I no longer do when I am at home alone. I do have stairs now. I can manage those. There's just things that, over time you just have to learn that you should not do. Now, but the thing is this, I'll be honest, one of the things I was talking about in terms of having a bad day is that it's what we call flares. And so it will come back, and then you get the swelling and the pain. And today I'm having quite a lot, I'm back in. And of course, I thought I was doing so well. Needless to say, I thought I was cured. but the thing about it, for those of you all that know people that deal with disorders and long chronic diseases, is that, certainly as a psychology person, I think about people that have depression or bipolar. They start feeling better, they don't want to take their meds. And so my level of compliance has not been what it should have been lately. So maybe that's the flare. And I like to eat like everyone else, which you cannot. I was just recently in Michigan and I went to a restaurant and they had this banana pudding. And of course I had to have some. I mean, you eat and say, I'm going to suffer the consequences. And you know, and you do, you know, and so that's the difficult part about it. But what I wanted to ask and what I thought was interesting, again, I mean, listen to this, pork, meat, sugar, we're talking about basic stuff, you know, and it's frustrating, you know, and it's kind of like you have to just kind of, it's like a puzzle, pull things in, pull things out until you land upon something that works for you. But one of the things is you said that my doctor hasn't talked about as much is the impact on organs. And I was just wondering if you could talk a little bit more about that.
Sure, great question. So yes, so the main reason we want to educate everyone, including patients and their doctors, to send us patients with suspected rheumatoid early is because rheumatoid arthritis can have a huge impact on the patient. It's not only the joints. Rheumatoid arthritis is a systemic process. The inflammation can extend beyond the joints. So the common organs that can be affected can include the lungs, the heart, eyes, infrequently the kidneys. The good news is that with early and prompt treatment, even with the regimen that you are on, Ms. Shirley, which is a great regimen, the inflammation decreases and then we are able to prevent organ damage. We also do imaging, at least I do. I check the lungs, I check the heart, I check the kidneys with blood work. So we do make sure our patients are not getting organ involvement. And if they do, then we need a holistic and a concerted approach. So we do, with rheumatoid arthritis, sometimes patients do end up needing more than one specialist just because if they have organ involvement. But this is a very, very important point to remember when deciding whether or not you want to take a medicine, because it's not just the joints and it's not just treating the immediate issue, which is pain. If you're feeling good and if you stop the medicine and you get another flare, it's basically your inflammation levels are going up, and that's when damage happens. So flares are common. I will say that flares get better as patients are more compliant, as the medicine works well. But flares can happen. You know, there are many reasons for flares: stress, unaccustomed activity, some dietary indiscretions, etc. Medications not coming in at the right time. So flares are a part of living with RA, but organ involvement is really something that we're very careful about. And thankfully, you know, we don't see that much anymore. Nowadays, RA is very treatable.
Thank you, Dr. Bose. And I just wanted to remind those who are on the phone, if you have questions, you can unmute by pressing *6. Again, press *6, and as I see your phones unmute, I will let you know to go ahead and ask the question. Did anyone else have any questions? I had one, but I said I wouldn't, but I do have one. Does anyone else have a question before I ask?
I have one more.
Oh, go right ahead.
How common is a fibromyalgia diagnosis along with rheumatoid arthritis or osteoarthritis?
So fibromyalgia is another condition that causes chronic pain and joint pain, muscle pain. So it can definitely, it is a very common reason for pain. A lot of times not really diagnosed because we don't really have treatment like diagnostic tools. I do see fibromyalgia coexisting with rheumatoid arthritis and osteoarthritis, which is why we try to evaluate everyone who has pain, even if it sounds like fibromyalgia, because sometimes fibromyalgia patients, it can masquerade as fibromyalgia and it's actually an inflammatory arthritis. I will say that the patients that I have in my panel who've had rheumatoid arthritis and fibromyalgia, when I've treated them, the fibromyalgia symptoms have gotten better. And I think that's because their fibromyalgia was coming from just the rampant inflammation causing pain and mood issues and just not sleeping well. And as we took care of the inflammation, that got better. If it's truly fibromyalgia, then that would not happen. So even if you take care of the inflammation, the fibromyalgia still continues. So it is certainly possible to have both in the same patient, but sometimes fibromyalgia can be secondary to just the ongoing issues with inflammation.
Thank you.
Ms. D, I see your hand is raised. Go right ahead.
Hi, good morning.
Good
Thank you
morning.
so much for the information and for taking our questions. My question is that at the beginning of the pandemic, I was having pain all over issues with exercise. I'm actually an exercise physiologist, and it just was curious that I had so much pain after I exercised all over. I had an ANA titer that came back positive, but everything else came back negative. So I went to a rheumatologist, and the rheumatologist did more testing, and the blood work, the labs came back negative as well, but I still suffer from the pain all over, tired. So he just diagnosed me with the fibromyalgia. So the information you just gave about the fibromyalgia was is very, thank you for that. But I don't know where to go from here because it's gotten worse. He actually put me prescribed a like an antidepressant. I can't remember what the name of it was. That also focused on reducing the pain. So I just go every day. I just deal with the pain overall. But I don't know if I should be looking to get further help, because you just said that it might be underlying inflammation that might affect all my organs. So I just, that's my question.
Sure. No, and I would really like to acknowledge and share how sorry I am that you hurt, because you're obviously trying to do the right thing, which is exercising. I'm really sorry that you're having these issues. I suppose my question is, what kind of exercise are you doing? How long is the pain, and does the pain happen before or after exercise?
I've been teaching high intensity indoor cycling, kickboxing, group exercise classes for almost 30 years. I never thought about how much pain I was in until past 10 years or so. I just thought it was normal because I work out so intensely sometimes that is just normal after exercise, post, DOM, delayed onset muscle soreness. So I just recently, the past 5 years, I kind of slowed down the exercise that I do. Now I'm only down to teaching maybe 2 or 3 classes, maybe 2 classes a week, higher intensity exercises. But I find myself completely exhausted and like a miserable kind of exhaustion. But I push through it because I love teaching. I love, I get my intensity up for about an hour, but afterwards I'm spent for the next couple days.
This doesn't really sound a lot like fibromyalgia. I do think that high intensity exercise, for all its health benefits, in the rheumatology world, we do recommend low intensity. And the reason is that over time, high intensity exercises lead to joint damage and more pain. So as we all go through life, our joints do wear down. There's nothing we can do about it. High intensity exercises over time may worsen that arthritis, that joint destruction and damage. So people who are involved in high intensity exercises or sports typically tend to have osteoarthritis, mechanical joint pain. And it sounds to me like your pain might be related to the kind of exercise you're doing. I don't know if you're able to change it. I do tell my patients to try to do low impact exercises where you're still getting your cardio, but you're not, stressing out your joints as much. Altering your exercise pattern, if it makes a difference in your pain, then it's probably related to the activity and may not be inflammatory. If it's inflammatory, then you should have pain all the time. Though it can get worse with activity, of course, but that's the way I'm looking at it.
No, I do now have pain, some sort of pain all the time.
You do have pain.
And I have changed up what I do that's less joint bearing type of exercises. I'm mostly on the bike now.
Mm-hmm. So you could have baseline osteoarthritis. Whether or not you have rheumatoid arthritis, hard for me to say, but if you have any deformities or joint swelling, then yes, definitely that needs a workup, because if you're having pain all the time, it certainly can be one of many things. If you don't have any systemic conditions, then it's unlikely to be lupus, because lupus usually extends more beyond the joints. Patients can have rashes, ulcers, hair loss, etc. But maybe getting a second opinion to have someone, just a fresh set of eyes to look at you, may not be a bad idea.
Thank you so much.
No problem. Good luck.
Thank you, Dr. Bose. And I think there were a few people that joined. I just wanted to let you know that we're at the Q&A part of the presentation. If you're on the phone and if you would like to ask a question, just press *6 to unmute. We do have a comment in the chat. Miss Mary says, I've lived with lupus for 25 years. And Miss Mary, did you have anything to say, any comments or questions that you wanted to ask or add? Okay, if you do just oh, she said no thanks though. Okay. Thank you, Miss Mary, for your comment. And did anyone else have any questions for Dr. Bose?
So there was a question in the chat about spinal stenosis relating to arthritis. I think that's a good question. That's why I wanted to bring it up. It came from Ms. Cheryl. So spinal stenosis is a kind of arthritis. It's the degenerative arthritis that can happen in your back. So the back, the spine is very prone to arthritis, as you know. The commonest kind of arthritis that affects our spine is degeneration or degenerative disc disease, and spinal stenosis is one of them. So the treatment really is, of course, you first need a diagnosis, and then treating it with physical therapy, topical cream, topical pain meds, and pain management is really the key.
Thank you. And there's two other questions in the chat. So one of the questions wants to know, I know we're talking about rheumatoid arthritis, but can you explain what all does a rheumatologist do, or what is the specialty of rheumatology? And then the next question after that is rheumatoid arthritis genetic?
So I'll take the second question first. Rheumatoid arthritis, as with other autoimmune diseases, all can have a genetic component. It's not just all genetic. So what I mean to say is that in the same family, we can see patients, moms and daughters, fathers and sons can have similar symptoms, but not the same disease. So they can have a different version of an autoimmune disease, or they may not have an autoimmune disease at all. You have to remember that an autoimmune disease starts in a patient with a combination of factors. There's genetics or genes, there's the environment, lifestyle, and some triggers. So if you don't have all of what it takes, you may not develop an autoimmune disease. Now, if we're talking about osteoarthritis is not really genetic, but it runs in families. So everyone, if you have a mom or a father with osteoarthritis, most of the times we see it in the kids, but osteoarthritis is just a common condition. So I hope that helps with the answer. And what does a rheumatologist do? So So I don't know if we're able to play a video. I actually have a video on what is rheumatology in my YouTube channel.
Okay.
Are you-
Found
are
it.
you-
While I'm pulling that up, I guess I'll ask my question so you can answer that and I'll get the video. So in finding Dr. Bose, by the way, her office staff is amazing. I found her from an article that was talking about rheumatoid arthritis in women of color. So I was curious from your experience, what differences, if any, have you experienced with your patients that are women or people of color, whether it's from diagnosis to treatment to, I guess, seeking out care, of being aware of rheumatoid arthritis, or anything that you wanted to share?
So obviously, I live and practice in Houston, Texas, which is a very diverse, cosmopolitan city. So we see patients from all ethnicities and background. And I was telling a patient of mine about this talk, and I was like, I never discriminate. So whether or not you're of color, you're still a patient of mine. But and I have plenty of patients. I think I was looking at my patient, but I have a lot of patients are women of color. Which is great because we want to help treat patients of all comers. But when I was asked about that article, the author, the lady who was interviewing me, made some very good observation that it is known in medicine that women of color or people of color tend to get less quality health care. Unfortunately, that's a fact, and we all need to acknowledge it. I will say that in rheumatology, at least in my clinic, we have a great patient population. All my patients, whether or not they're of color or not, they come to me. They are engaged. They're happy to listen. I think that when I don't form a connection with a patient, that's when things fall off. And a lot of things go into forming that relationship or bond. I'm pretty good at forming a bond, but sometimes I just can't get through. And a lot of things, I think, fashion someone's perception of what a doctor is or what a doctor could do for you. A lot of it is, I think, personal preference, your family, your social support. So in rheumatology, we're all very conscious of women in general because most of our patients are women. So we advocate for women. And we're also very conscious of the fact that women of color may not be seeking out care at the right time. I find that in all women, actually, that is a problem. They tend to keep taking care of everyone else and not themselves. And I educate my patients that you have to take care of yourself because, that comes first. So in my community and where I live, the primary care doctors are so good, and they're all females. So they do a great job of educating their patients and sending them to me. So by the time I get my patients, they're all ready to rock and roll with me. So they're ready to accept my advice. I will say that I've had some trouble getting through to some women of color with lupus. And usually it's a lack of understanding, a lack of education, a lack of understanding that they can get very sick. And in that case, they fall off the grid. And we as physicians can only do so much to bring them back. And then when they fall off the grid, that's when I think disparities start.
Thank you, Dr. Bose. And I'll go ahead, and I found the video. Would you like me to play it now?
Please.
Okay, and then after that, I will go to the chat. There's a statement in the chat, and then I believe a few other people joined, so we'll give them the opportunity to ask questions. So I'm going to pull up her video. What is rheumatology? This is in regards to a question that was asked about what exactly rheumatologist treats. Here we go.
What is rheumatology? I get asked this a lot. Rheumatology is the branch of internal medicine that deals with patients with autoimmune conditions. Again, what is autoimmunity? Autoimmunity is a condition when your body starts fighting against itself. Some examples of autoimmune diseases include lupus or SLE, rheumatoid arthritis, psoriasis, psoriatic arthritis, ankylosing spondylitis, scleroderma, Sjogren's syndrome, polymyalgia rheumatica, sarcoidosis, vasculitis, etc. In rheumatology, we also take care of patients with other conditions involving the bones and joints, including osteoarthritis, gout, pseudogout, tendinitis, and bursitis. We also take care of patients with certain bone conditions, including osteopenia and osteoporosis. Thank you.
All right. Did someone have a question? Did I see a hand raised? Go ahead, Professor.
You know, it's, as she was, I was looking at the video. One of the other things that I, as part of the regimen, and you know that women of color in particular tend to have very serious vitamin D deficiencies anyways. And so a lot of times that will become part of the regimen. And I just thought it's so interesting. Of course, you know, it makes, when we step back and we look at it from a common sense perspective, you know, when we talk about issues around stress, and then we have the superwoman syndrome anyways. And so, you know, the likelihood of us, I mean, it all kind of comes together. But one of the things that I'm sure the doctor probably, she didn't mention, but I'm sure maybe or hopefully her patients have come to understand, is the importance of sleep and the reduction of stress, and the reduction of stress at all costs. I mean, you just have to say no to committees, no to family, no to folks, because that stress and all, you know, it's just, it can just such a trigger, you know. And so those lifestyle issues and that's what I think sometimes impacts women of color greatly, is because we come from a place of yes, and we don't put ourselves first, you know. And as I think about this, I think about our ancestors. If you can only have imagined working those fields and things like, you know what I mean? And again, just dealt with it, you know what I mean? And so it is, I'm just so grateful that now we're acknowledging the reality of it. And I hope that we can continue to talk about it, and that we give each other grace and allow women to talk about something that, you know, we think, well, you know, put ourselves second. It's no big deal. We've always dealt with pain, but this is a bit different. And because of the putting it on the back burner, it can, you know, can really get quite bad. And so I'm just so grateful for this time and this space, you know, to talk, and hopefully people will continue to talk about it and to share, you know, their life experiences as we move forward.
Thank you, Professor. And there's a comment, I didn't want to miss it. When we were talking about lupus, and Dr. Bose was sharing that she has encountered some challenges with women of color coming who have lupus. And Mary Wells, who told us earlier that she's lived with lupus for 25 years, she highly recommends being a part of and connecting with the support group. Ms. Wells, she shared many of the events that are going on to focus on women of color, specifically Black women, and she facilitates a lupus support group, which is wonderful. I was able to attend. I don't have lupus, but they did invite me to go. And the camaraderie amongst the women and just the support that they have one another is amazing. So I know today's topic is rheumatoid arthritis, but if you are looking for a lupus support group, you can send Miss Mary Wells, who's on with us here, a private message with your information, or you can contact me and I'll get you in contact with Miss Mary Wells. We did have a few other people join. I believe we have a few more minutes. For those of you who have joined, Dr. Nilanjana Bose has provided us with a lot of information. She has very concise yet very informative videos on her YouTube page. We will be sharing that link with you so that you can find her on YouTube. But at this time, if you have any questions related to rheumatoid arthritis, other rheumatic disorders, or any other questions or statements for Dr. Bose, we do invite you to unmute if you have anything that you would like to say. Even if you just joined, it's okay if you have any questions. This is what we're here for. We're very laid back. Did anyone else have any questions for Dr. Bose at this time? And we are recording this, so even if you've joined late, it's okay. We will get this video sent out to you. If you're not a part of our email database, you can private message me, Shanae. I know I'm under Judea Hill, but you can private message Shanae Rhodes, and I will make sure to get the recording over to you. I will also send this to Dr. Bose as well, so she will have access to her session. And I do see Sister Shirley raised her hand. Go ahead, Sister Shirley.
I want to thank you so much for the information. And it even has, in the testimony, has, even though I've worked with patients and you know, been with patients that had it or families, it really has, I don't know, really has opened my eyes more, you know, to understanding how women are maybe silently suffering and, you know, trying to endure, go on, press on, trying to endure it, and not really, you know, like Professor Wright say no sometime, or seek out the help of professionals like Dr. Bose. So thank you so much. Appreciate you so much. And then gout. People are suffering with gout a lot, so I was glad to hear that. Thank you very much.
My pleasure. Anytime.
And I wanted to say a special thank you to Dr. Bose. Having done these sessions and having these open discussions, you know, I've learned more and more about how it's difficult for women in general, but, you know, also women of color more specifically, to either get the help that they need because maybe they're not knowledgeable, or maybe they're afraid because of distrust with the medical communities, or you know, they're trying to get the help but they don't feel like the doctor or the provider is listening. And I want to thank Dr. Bose. I want to thank her for her genuine. I've had conversations with her prior to this meeting, so I've had the pleasure of being able to get to know her over the phone, and just being a genuine provider. You know, someone, like she stated earlier, I take care of all my patients regardless of what race or gender they are. I'm there to help. And she didn't tell me to share it with you, but she has a YouTube video with, it's a man of color. It's an African American man, and at the bottom it says he's talking about how much he loves Dr. Bose. So it's always good to hear from, you know, the patient's perspective, what they feel about the doctor, what their experience has been with them, and even from, you know, the office staff. That's one of the things when I'm looking to go to a place. Not only am I looking at the physician or the provider, I'm looking at my experience from the beginning to the end. And Dr. Bose's staff, they were amazing. I felt bad because I kept calling. They're like, oh no, you're fine. And I did want to let you guys know, Dr. Bose did not ask me to do this, but we were talking about COVID and how things have impacted the medical industry as well as the patients. And so she does offer telehealth. So if you are looking for a rheumatologist, Dr. Bose, I believe, is accepting new patients, but we'll give you her office number. I will show that here shortly, so that way you can contact them, see if your insurance is accepted, and do whatever you need to do. But she does offer telehealth as well if you're looking for a rheumatologist. And we just heard, you know, rheumatology is more than just of diagnosing rheumatoid arthritis. I'm going to share my screen real quick before we let Dr. Bose go. I wanted to show you guys her information. So please feel free to take out your phones if you want to snap a picture. If you would like to write it down, I'm also going to go ahead and read the information out, but this is also part of the recording, so you will have it here. Dr. Bose, as I had stated earlier, in case you missed it, she began her own practice. We're so excited for her. It is called Lonestar Rheumatology, and so proud of her because not only is she an MD, she has her MBA. This is a woman in business, y'all. So this is she's an inspiration to us. She is stationed in Houston, but again, she does offer telehealth. Her phone number for her office is 713-588-1674. Again, that's 713-588-1674. You can also visit her website. It's www.lsrheum.com. Again, that's www.ls for Lone Star. And then instead of rheumatology all the way spelled out, it's Rheum. So it's RHEUM.com. And if you go to YouTube, I do have the link here, but for those of you who are on the phone, if you just look up Dr. Nilanjana Bose, her videos will pop up. And it's also listed under LS Rheum. But her first name is spelled Nilanjana. Her last name Bose, Bose. And if you're on Facebook or Instagram, you just go to LS Rheum. Again, that's for Lonestar Rheumatology. It's L as in Lake, L as in Sam, Rheum, RHEUM as in Mary. And so, Dr. Bose, I'm going to keep this on the screen. I want to personally say thank you, and on behalf of all of us here at MSK, for taking time out of your Saturday. Dr. Bose contacted me immediately, and I was like, oh my gosh, thank you so much. And she said, I would love to do it. This is what I'm passionate about. We're so grateful for what you do. We're so grateful that you're a rheumatologist. We're so grateful that you're passionate about serving all people, regardless the race, the gender. And we are here for you. I know we're a small group, but if there's anything we can do, we're going to compile you and put you into our resource list. So as we come across different groups of women, and if they're looking for a rheumatologist, we're gonna tell them Dr. Bose is your doctor. So, but I'm going to leave the last words for you, Dr. Bose, if you had anything to say, and then we will finish concluding our session.
Well, I just wanted to say what an absolute honor and pleasure it has been to work with you, Shanae, and to be a part of this wonderful group and community. I really hope and pray my patients find a community like this, because I always tell them it's one thing to listen to your doctor, and it's another thing to connect with patients who are like you. And to hear positive stories. We don't always want to hear negative stories, because you don't want to be weighed down. You want to be lifted up. And I think women need to do that. We need to empower each other. So I'm not a feminist, but I do think that we need to all support each other, men and women. But women do a lot for their families, and so we need to support our the women out there and be there. So it's been an absolute honor, and I'm happy to help in any way. I did want to make a comment that the phone number, Shanae didn't know this, but you can text us actually at our phone number. So yeah, we've made it easy, and I'm only licensed in Texas, so I can only do telehealth in Texas. But I wish everyone a good, happy, healthy life, because I think health is wealth. And thank you so much for allowing me to be a part of this. Honor.
Thank you so much. Thank you so much, Dr. Bose. Well, guys, I'm going to go ahead and stop the recording at this time. We have a few other announcements, but I will end off with Dr. Bose. And Dr. Bose, feel free if you want to stay on. If you're all set to go, you're good to go. Again, we appreciate you so much. Thank you for joining us. Alrighty, ladies. So for the rest of, and I won't hold you much longer. We're almost done.
Sister Shanae, this is Sister Gwen.
Hi, Sister Gwen.
I couldn't say anything until I parked, so I wasn't going to say I couldn't do anything until I got to a parking spot. Yeah, I was driving. I was listening, but I was driving. But and you may have already said this. Is there a referral, or does she have any referrals in San Antonio that she could refer?
Oh,
would those be available? On the website, or be able to get those?
That would be a good question, and unfortunately, she just left us.
Okay.
We have her information, and what I can do, that's a very good question, Sister Gwen. I will text her as soon as we end here, and then get her response, and that way I can send it out with the video. And so everyone can have, I think that's a very good question, and I'm so sorry that we didn't get to ask that to her while she was on here.
Yeah, I was trying to get to her. That's okay though. We'll get it. Thank
I'm
you.
sorry. Alrighty, lady. Oh, I'm sorry?
Yeah, it's fine. Thank you.
Okay, thank you. Ladies, so just real quick before we conclude for the day, I just wanted to let you know that if you'd like to receive a copy of today's recording, and if you're not already a part of our email list, if you did not get an email an invite through email, you can PM me, here on Facebook, on Zoom, on Zoom, under Shanae Rhodes, your email address, and I'll make sure to get that video out to you. For upcoming MSK topics, our next topic that we'll be discussing is blood transfusions in communities of color with Miss Jennifer. We don't have a date and time yet. I'm coordinating that with her now, but it's going to be in July. So I will be sending that out as soon as I get as soon as we nail that date down. You may submit specific information or questions that you would like for the upcoming speakers to address by emailing us at mymsk2020@gmail.com. I also have it listed here on the screen. A survey link will be placed in the chat. Actually, I will text that to you guys, but I'll get it here in the chat here shortly. The survey is anonymous. It takes about 3 minutes to complete. We ask that, we know I don't like taking surveys, I'll be honest, but we do ask that you take the survey, even if you've taken it before. This is a whole new topic. We just want to know what other topics you would like to know about. What did you think about today's session? And these are things that we actually pass back to the speaker to let them know how the session went, and it really encourages them. So we make the survey intentionally short because we know a lot of people don't like to do surveys. And then last but not least, we also ask that you will like us on Facebook. If you're on Facebook, you can just look us up at MSK of Texas. Again, that's MSK of Texas. And then I am going to go on to the next one. We're doing something a little new with MSK. We want to highlight some of the businesses that are led by women of color. So today's business spotlight, we are featuring 2 young ladies. First is M&M Eye Candy Jewelry by Mitzla Mitchell, and I'm actually wearing some of her pieces right now. I have my little pink necklace and my little pink dainty earrings. All jewelry is $5. So I like it because it's cheap. It's nickel free. I'm allergic to nickel, so I love it. She shipped out her orders on Sundays, and she also has live shows on Facebook at 7 p.m. on Wednesdays and Saturday nights. And then she has her website here, paparazziaccessories.com. If you go there, you can find her by typing in number 437367. And then we also have Masterpiece Hair Care Products by, it's saying Breechell, but that's not right, by Bree Styles, it should say. I don't know why it has that up there. But CEO L. Bree Miller, she's here in San Antonio. On her site, she has shampoos, conditioners, serums, other hair care products. Her products, some of them are vegan, and they're for all hair types. So not just women of color, for all hair types. But her Masterpiece collection, you can't see it, is very small, but it's actually a ministry of hers. So she has biblical ties to each product to empower women in general, no matter what race. And if you would like to see more of her products, you can go to Bree Styles, that's BRESTYLEZ.com. You can get a view of all of her products, and she's also a stylist here in San Antonio. My daughter, myself, and my niece have been going to El Bree for 10 years, and I can tell you my hair is healthy, and I don't have a relaxer anymore. And at this time, I am going to go ahead and share the link to the survey in case you would like to take that. And while I'm getting that prepared, I just wanted to say thank you all for joining us on this Saturday. Again, taking time out of your busy schedules to talk about this very important topic. As a nurse, I'm learning so much, and I know that it's helping me to become a better nurse. But I'm going to go ahead and pass this over now to Sister Shirley Fennell to close us out with prayer. If you have any prayer requests, please feel free to speak them out now, or if you'd like to share them in the chat. And then I'm going to mute myself, and I'll be sure. Yes, ma'am.
Yeah, Sister Gwen wrote a poem.
Oh, Sister Gwen, yes, we don't want to miss that. Sister Gwen, please present us with your beautiful poem, and then we'll follow up with Sister Shirley's praying for us.
Oh, let me go. I got to go back to it. Hold on.
Okay, take your time, hon. You're fine.
Oh, y'all put me on the spot. Just walked through the door.
You know we're laid back. You're okay, sis.
Can you hear me?